Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The patient activation measure assesses a patient's knowledge, skills, and confidence essential for managing their own health and healthcare. It evaluates the degree to which individuals are engaged in activities such as adopting preventive behaviors, adhering to treatment regimens, and maintaining self-care routines. The main purpose of the tool is to identify activation levels to tailor interventions that improve patient outcomes in chronic conditions like diabetes, heart disease, and asthma. By measuring activation, healthcare providers can better support patient empowerment and facilitate effective disease management. The patient activation measure is indicated for adult patients with chronic conditions such as diabetes, heart disease, and chronic obstructive pulmonary disease. It is most useful in outpatient primary care and disease management settings where self-management support is critical. The measure identifies patients' knowledge, skills, and confidence levels in managing their health, enabling tailored interventions. Studies show that higher activation scores correlate with better adherence to treatment and improved health outcomes. It is particularly relevant for populations with complex care needs and those at risk of hospitalization due to poor self-management. The patient activation measure consists of 13 items assessing an individual's knowledge, skills, and confidence in managing their health. Each item is framed as a statement about health-related behaviors or attitudes. Respondents indicate their level of agreement using a 4-point Likert scale, ranging from strongly disagree to strongly agree, with an additional option for not applicable. The administrator instructs the patient to read each statement carefully and select the response that best reflects their current status. After completion, raw scores are calculated by summing item responses, excluding any not applicable answers. These raw scores are then converted using a standardized scoring algorithm to produce an activation score on a scale from 0 to 100. Scores are categorized into 4 activation levels. Level 1 indicates scores between 0 and 47.0, reflecting disengagement and low confidence. Level 2 ranges from 47.1 to 54.9, representing emerging awareness but limited management. Level 3 spans 55.0 to 67.9, denoting beginning to take action. And Level 4 covers 68.0 to 100, indicating maintaining behaviors and confidence. Higher scores correspond to increased activation and better self-management capabilities. Clinicians use these levels to tailor interventions and support targeted at improving patient engagement. The sensitivity of the patient activation measure refers to its ability to correctly identify patients who are truly activated, meaning those who have the knowledge, skills, and confidence to manage their health. Specificity indicates how accurately the measure identifies patients who are not activated. Published studies report variable sensitivity values for the patient activation measure, generally ranging from 0.70 to 0.85. Depending on the population studied and the activation threshold applied. Specificity values tend to be higher, often between 0.80 and 0.90, reflecting the tool's strength in correctly identifying non-activated individuals. For example, in a clinical setting, a sensitivity of 0.80 implies that 80% of patients with high activation are correctly classified, while a specificity of 0.85 means that 85% of those with low activation are accurately recognized. These metrics support the use of the patient activation measure as a useful tool for tailoring interventions based on patient activation levels. The patient activation measure was developed in the early 2000s by Judith Hibbard and colleagues at the University of Oregon to quantify patient knowledge, skill, and confidence for managing one's health. Validation studies have demonstrated strong psychometric properties, including high internal consistency with Cronbach's alpha values typically exceeding 0.9. The measure's construct validity has been supported through correlations with health-related outcomes such as medication adherence, preventive care utilization, and chronic disease self-management. Longitudinal research has shown that higher activation scores predict improvements in health behaviors and clinical indicators over time. Additionally, the tool has been cross-culturally adapted and validated in diverse populations and healthcare settings internationally, reinforcing its reliability and applicability. Multiple peer-reviewed studies have also confirmed the measure's sensitivity to change in response to targeted interventions aimed at enhancing patient engagement. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.